Hello, my name is Dr. Seemal Desai. I'm a board-certified dermatologist specializing in skin, hair, and nail conditions with a particular focus on pigmentary disorders. I'm a clinical associate professor of dermatology at the University of Texas Southwestern Medical Center and founder and medical director of Innovative Dermatology in Dallas, Texas. In this video, I will be discussing vitiligo, an autoimmune dermatological condition resulting in discolored patches of skin, hair, and mucosa. With this condition, the immune system attacks its own melanocytes, which are the cells that produce melanin. In 2020, it was estimated that vitiligo affects between 0.76 and to 1.38% of US adults based on a population-based study, which translates to 1.9 to 2.8 million cases. In order to develop appropriate treatment plans, it is crucial to accurately identify each patient's condition as either stable or active. The focus of this video will be to briefly discuss the differences between stable and active vitiligo. According to the International Vitiligo Task Force, most experts agree that stable vitiligo can be defined as having no new lesions and no progression of existing lesions over the past 12 months. In other words, the number and size of lesions in stable vitiligo patients remains constant over a period of 1 year. Stable vitiligo lesions are defined in their appearance with well-defined fixed borders and depigmented patches that tend to be surrounded by normal skin. At a more granular level, stable vitiligo is characterized by the noticeable complete loss of melanocytes in previously established lesions, but with little to no immune infiltration at the site of the lesion during presentation. Treatment goals for stable vitiligo include potential maintenance stabilization treatment and repigmentation or depigmentation with either surgical or non-surgical techniques based on disease activity and extent along with shared decision-making. By contrast, active vitiligo is typically characterized by the formation of new lesions or progression of existing lesions, which due to the active melanocyte destruction often present features that indicate active spreading and potential progression of the disease, showing diffuse borders and even trichrome patterns. However, it is important to note that there is not currently a consensus on how to define active vitiligo. There is a wide array of active vitiligo morphologies, including trichrome disease, which is characterized by 3 distinct skin shades within a lesion. A depigmented area centrally, surrounded by a faint, oftentimes yellow to tan brown color, and then the patient's characteristic skin shade in the periphery. The Kebner phenomenon, where new depigmentation occurs at a previously unaffected site after skin injury, confetti-like depigmentation in which small lesions develop at the edges of existing lesions, and inflammatory vitiligo, where raised erythematous borders develop around the lesions. Notably, multiple morphologies of instability can coexist in some patients. Ongoing inflammation, high levels of inflammatory cell infiltration, and elevated levels of inflammatory cytokines are observed at the edge of depigmented areas. Because of its progressive nature, treatment goals for active vitiligo focus on stabilizing the disease, followed by repigmentation or depigmentation with non-surgical techniques. In summary, stable vitiligo is characterized by no increase in size and/or number of lesions, and the lesions are well-defined with little to no immune infiltration. Whereas active vitiligo is characterized by active spreading of lesions with diffuse borders and immune infiltration. Treatment for stable vitiligo can include optional maintenance therapies and stabilization treatment before repigmentation or depigmentation. While treatment for active vitiligo must first begin with stabilization before repigmentation or depigmentation, which, unlike in patients with stable disease, cannot be done using surgical techniques. Importantly, each individual patient can have lesions that are stable, unstable, or regressing, and therefore an understanding of the stability of vitiligo lesions is crucial for monitoring disease progress and for developing an appropriate treatment plan for each individual patient. To learn more about the main types of vitiligo based on clinical classification, please check out our other videos in this series.